Hi, my name is Dr. Bliss Lewis, and I'm a psychiatrist, and I'm also a child and adolescent psychiatrist. And I combine conventional psychiatry and child psychiatry with integrative medicine principles. So I also know a bit about all kinds of different things that fall under the umbrella of integrative medicine. So today, let's talk a little bit about kids and child mental health, and specifically about thoughts that come up and questions that come up around children and therapy and children entering either for psychiatric evaluations or anywhere in the mental health system. So maybe as a society, we are calibrating right now. Child mental health was largely neglected and not paid attention to and not really studied. And now there's been a lot of attention and maybe actually an over-medicalization of certain things, with pediatricians screening children routinely for suicidality, kind of reading off a pretty intense list of questions. Even if there's no concern, right? So it's we're finding our midpoint there, finding the new balanced place to take the best possible care of kids. And kids are having a hard time, right? So the rates of mental health concerns in children, despite all of this research and attention to child mental health, are quite high. And even now, with more attention to child mental health, overall, as a subspecialty, this is an underserved specialty. So there are far fewer child psychiatrists available than there is need and demand, right? There are big chunks of the country where there are no child psychiatrists, right? So it's not like it's some huge boom of child psychiatrists, right? There are probably many more child psychotherapists, but even psychotherapists are not necessarily so easy to come by in big areas of the country, right? So this remains an area where we have less research than in adults, less research on treatments, on conditions, on presentations, less research on medications than in adults, right? So still kids are a vulnerable and kind of neglected population. And there's this question of are we not giving kids enough mental health care and attention, or potentially too much, right? And each individual family and parent will have to figure this out for themselves, how they relate to getting outside help versus working with their pediatrician and within the family, right? So how to know when the child actually should be evaluated and when to involve a professional, right? Hopefully you can access a professional when needed. So those are things that are more serious and impact your child and potentially put your child at risk, right? So if there's serious depression and maybe your child is having a hard time just doing their normal things, like going to school, going to their activities, engaging with friends, getting their work done, functioning within home, within school, within whatever other areas, to the point that it's really affecting them, affecting their function and affecting their mood, self-esteem, then it should be considered, right? And a lot of things, I think really parents are the first therapists, right? So really a lot of the therapy, a lot of the work that happens when I work with families and with kids happens with parents, right? And sometimes the entire treatment is just me working with the parents and supporting the parents, encouraging the parents, educating the parents. Actually don't need to see the child, right? So you are your kid's first caregiver, and the psychiatrist or psychotherapist is really, in a way, a consultant to the parent primarily, right? Entering a child into psychotherapy is almost like a secondary thing, second line. At least that's the way I work, right? And depends on what's going on the age of the child, on the condition, on the family, right? Availability of parents that are really able to like work with the child closely, right? But we also now have evidence-based, like well-researched treatments, which don't involve the child, right? It's the therapist and the parent, right? Figuring things out and figuring out how to help a kid, right? For example, SPACE is this treatment for anxiety that's really between the clinician and the parents, and the clinician teaching the parents, empowering the parents to help their child, but really also helping the parents feel that it's okay for their child to face their anxieties, right? So it's maybe also helping work through the anxieties of the parents, or the kind of the nervousness to let their kid have a hard time and experience anxiety, and to give the parents permission, right? Permission to like believe in their kid and believe that their kid can do it, whatever, go to school or call a friend or something like that, look for a job. And that, I don't need to see the child for that, right? That's really the parents. And that treatment even has a version for young adults, like a failure to launch population, where the young adult with anxiety is just kind of hanging out at home, not doing anything, maybe just, living an online life and not looking for work, not trying to do anything because of feeling uncomfortable and anxious. And again, the treatment is between the parent of the adult child now, right? Maybe a 19-year-old or 20-year-old, 21-year-old, and the clinician, right? And it's really giving the support and guidance to the parents. And whenever I work with kids, it's all, even if like we find a flow, we find a balance, it's, maybe 50-50, like half of the time is spent with the kid or adolescent in sessions, and half with the parent. When with an older adolescent, there's a lot more time with the adolescent, right? So kind of with age, that ratio changes, and with an older adolescent, I might be spending most of my time with the adolescent and some, little time with the parent, but at least 15% of the time I need with the parent, right? Because the parent is the primary person there. And I have some teens in treatment where, even after turning 18, we just have this flow of meeting together, the teen and the parent and I, right? And that works too. And there's a lot faster communication. So this can be, it just depends on the individual. These concerns, though, that at all entering the mental health system could bring stigma to a child, that child could be diagnosed, that if you have the child evaluated or do a neuropsych or have some kind of a school evaluation, the child will be treated differently, or that the child will like label themselves, or that their family or friends will label the child. Like, that's a real concern, right? We still live in a world where stigma and shame around mental health is a real thing. And of course, you don't want to make your kid's life more difficult by attaching some kind of a label that could cause them pain and suffering or discrimination, right? And there are particular labels maybe that parents are particularly nervous and worried about, right? That could be ADHD, that could be autism, right? Autism is probably, high-functioning autism, very complex, right? Very complex emotionally for everybody, for the family, right? And knowing how to treat, what to do, whether to do extensive testing, right? There's so much comes up about it, right? And whether to disclose this diagnosis to a school, right? Sometimes it's very clear, right? When things are really tough for your child, it might be necessary, right? It might be necessary because you need educational adjustments. And sometimes it's not necessary. And then it's up to the parent's best judgment. Do you want to disclose whatever issue to the school or not? Right? How do you feel about that particular school? So this is a big journey, right? And even the thought of like, will my child take on some stigma? Will my child take this on as like an identity and become, defined? I'm depressed individual. I'm anxious kid, right? So, there's an absolutely necessary like mindfulness and thoughtfulness in how we talk to kids about mental health issues. There's a lot about language, right? Using kind of normalizing language like worries, right? You have worries, I have worries, we all have worries, rather than anxiety disorder, right? That can be helpful for a kid, right? Approaching it as a whole family, the parents taking responsibility for supporting the child, right? It's like, I'm going to help you, in how we're navigating around anxiety or around OCD, right? But we're using the right words, which would be worry, right? Or these like habits, right? So, so there's so much, and a lot of that happens without the child in the room, right? So it's in a way, you as a parent do protect your child from, having a whole lot of appointments or being pulled out of their activities or missing out on things by doing a lot of the legwork yourself, right? And once the child is older, right, an older adolescent, then it's important to take a step back and allow the child to have, or now adolescent, to have privacy, right? So privacy is so, so important in mental health treatment, and children also need privacy, right? So parents have the right to know what's going on and communicate with the therapist or psychiatrist, but also there's this desire to protect some privacy for the child so the child will feel comfortable disclosing things, especially an adolescent, right? To disclose something about sexual explorations or about experimenting with tobacco or alcohol or whatever, right? Like if there's no confidentiality, it's far less likely to happen, right? That makes the treatment less useful than creating an opportunity for the child to have another safe place, secure attachment, and a safe place to like ask some questions and figure some things out, right? We live in a society where there's a lot of peer orientation in teens. So peers are the other teens, right? So the child orients towards all the other kids rather than orienting toward loving adults and family. That's not good for teens, right? Especially younger teens. And so creating a place where there's another safe adult to like talk through something and get adult input and perspective is so valuable. Of course, you want to be one of those people, but sometimes like it's good to have someone else there who can be a person the child can orient towards and get input from. So a lot of parents have concerns about treatment and whether to use medications with children, which medications, are medications safe at all? Is it a good idea? And those are good questions, right? We should be very thoughtful when considering medications in children. And we have less information, less research, fewer medications that are available or FDA approved to use with kids. It's kind of, it's a pity, right? There's actually like not enough research, and some of the new medications are like, there's not even that much attention, right, on how those medications could potentially be useful in kids. So yes, it's important to be very thoughtful, and it's important to pause and think and really consider options and look at the big picture and consider what's the best course of action, what is in the child's best interest, right? And sometimes it is very clear, right? When things are really serious, it is very clear that the risks and benefits of medication far outweigh the risks of not treating with medication. And sometimes it's less clear. Sometimes it's like, I don't know exactly, right? Like, maybe, right? Or certain things are very treatable, right? And we know we have medications that are likely to help a lot. And some things are not as responsive to medications, right? We have reasonable medications for ADHD, for anxiety, for depression. What about like trauma and PTSD? Not so much, right? So it depends like what's going on. And for some things, right, there are non-medication options that are great. So of course, especially with kids, it always makes sense to consider non-medication options first. And sometimes when kids come into my practice, right, it's like, okay, let's do 3 months of lifestyle supplements, tuning up the diet, right, figuring out school structure, sleep schedule. Let's tune everything up. Let's add more exercise, right, before we go to medications, right? So medications are like one of the tools in the toolbox, right? But they're number 5 or maybe even number 10 on the list, right? And hopefully you have 4 or maybe 9 other things higher on the list to implement and to do before going to medications. And sometimes medications are wonderful and helpful and necessary, and wonderful that that tool is in the toolbox, right? It just shouldn't be the first thing and should be the only thing, right? It should be one of many things in the toolbox to be used as needed, right? And other tools might be used at other times. Therapy, lifestyle interventions, nutrition, school accommodations, improving interpersonal skills, mindfulness, things like that. And if medications are recommended for your child, or if you think like, well, I think we're at the point, we considered other things, we tried other things, and medications seem like important to try, then that's you're there, right? Then that's clear. And it's engaging in this process of trying medications and figuring out which one is best, right? So kids react somewhat differently than adults to medication. So it takes skill and sometimes takes trial and error to figure out which medication is the right medication. And sometimes also, kids are developing, they're young. It's not clear what's going on, right? It may not be clear yet, like, is this just a unipolar depression, or is this potentially going to be bipolar disorder, right? So if the initial treatment is with an antidepressant, but the child gets like agitated and overactivated, it's like pause and think like, okay, either this child is very sensitive to SSRIs, or potentially there's some predisposition to bipolar, right? And we should totally be very careful with these medications and potentially switch to mood stabilizers. So that takes like care and attention and thoughtfulness, and kids are growing and things come up, right? Like these disorders are confusing when they just begin to present. And, we also want to do everything we possibly can to stop the progression of a disorder, right? And sometimes medication can help to do that, to stop the progression, to slow down the progression. And sometimes it doesn't involve medication. It's just lifestyle and food and stress reduction and avoiding, smoking weed, because THC definitely increases risk for all kinds of things. So, it's like figuring out what's the right time. And there's definitely some art and some science here that are like blended together, and often you may get somewhat different recommendations from different clinicians, right? Even if the mainstream recommendation in child psychiatry is to start with serotonin reuptake inhibitors, SSRIs, some child psychiatrists, including me, are careful with those because we don't really know exactly how starting an SSRI early on will affect a child's sexual development, right? Like if these medications potentially affect sexuality, right? Libido, orgasm, right? To start a child on a medication who is just maybe beginning to become a sexual being, right, in teen years, there's a question, right, of like, what's the impact? So when it's needed, it's needed. And also, like, it takes care and thoughtfulness and trying things that are safest first, right? So least possible negative impact before going to things that are potentially more complicated, right? Even if a medication, like obviously this one could be like the easiest, fastest thing to treat anxiety, but maybe if you respond to something that doesn't have these side effects, it's worth a try, right? Maybe we can get away with something else before going to an SSRI. One thing that, I would encourage parents to keep in mind is if your child is in psychotherapy, it's important to really stay closely connected and in touch with the therapist, right? And ideally, you would want the therapist to tell you what they are observing and what they think your child needs in terms of like learning skills and strengthening and reinforcing skills, because likely your child is seeing the therapist for 45 minutes a week, but then you're home with them for so much more time, right? Hours and hours and hours every day. So if you know, like, okay, my child struggles with transitions and we're working on using, these 3 skills to make transitions easier, and both the therapist and the parent are both kind of reinforcing that and praising and noticing, right, progress and encouraging and allowing the child to like practice these skills, right, that will be very helpful, right? Or the therapist may not know what's actually going on, right? So if the child just comes with no update from the parent, the child might be like, everything's great, nothing happened, right? And chat about something about school or special interests. While the parent might be like, oh, yesterday my child didn't go to school because of whatever, stomach ache or something, or anxiety. Or 3 days ago, this and this happened, right? So you really need to give that information to the therapist, not count on your child to report that information. That may be like the last thing that your child wants to like talk about in therapy. And the therapist may not bring it up, right? But it might be useful to know, right? So I encourage parents to like send me a message, right? Send me a text, send me a voicemail, send me an email. That's the best, right? Describe what's happening. How are things going before I see the child, so I have an update, right? So the conversation I have with the child, at least I have some idea of what's been going on and how the parent perceives the child doing, right? As, teens become older, there's always this like delicate line around privacy. But even after 18, like a parent is allowed to leave a message and leave information, right? Or send an email. Like people can give information. I may just not have permission to respond. So it may still be useful, right? To provide the clinician with information. So with HIPAA rules, you're allowed to give information, but the clinician is not allowed to give information back.